I think one of the things that is so confusing to patients about breast reconstruction is just the terminology that is used by both patients and providers, but sometimes in the wrong way. So let's just start by discussing some very rudimentary terms. When we talk about immediate breast reconstruction, that refers to something being done at the time of your cancer surgery. So if you're having a mastectomy, it could be implants or an autologous reconstruction. If you're having a lumpectomy, it might be a breast reduction done at the same time, immediately. That is opposed to a delayed reconstruction. A delayed reconstruction means a reconstruction that is started on a day separate from your mastectomy. Now, why would you do this? There are actually many reasons. One could be your tumor characteristics. It's actually safer to wait a little bit to start your reconstruction. Maybe it's how healthy you are. Maybe it's better to optimize you a little bit after your cancer surgery to give you the best chance for success with your reconstruction. Maybe it's your decision. Maybe you didn't want to have reconstruction at the time of the mastectomy, but down the road, you decided that it was right for you. These are all reasons why someone might have a delayed reconstruction. Further complicating things, though, is what's called delayed immediate. What that typically refers to is where a patient's ultimate plan for reconstruction is to have some type of body-based surgery. We typically call those flaps. But for whatever reason, it can't be done, or it's not best to do at the time of the mastectomy. In those cases, sometimes we just have you do your mastectomy, do the flap later, delayed reconstruction. But an immediate delayed would be placing a temporary space holder called a tissue expander, which we'll talk about later, at the time of the mastectomy, knowing that the ultimate plan for reconstruction is going to be that flap down the road. So you can see how the flap is delayed, but we're doing something the day of the mastectomy, so it's called immediate delayed. There are pros and cons to all of these approaches, and these are all approaches that your plastic surgeon should discuss with you. Once again, they're based on your cancer characteristics, your treatment plan, and your overall health, all aimed at giving you the best possible outcomes for your reconstructive journey. Does that make sense? Let me know below.